I know, right?
So are you ready to uncover the secrets of these, like, everyday medications?
Absolutely.
Let's do it. We're going to figure out how they actually work,
Yay.
why some knock you out and others don't,
Okay.
and all the surprising things that they can actually do.
What's really interesting to me is that most people just pop an antihistamine without really knowing what they're even fighting.
Histamine.
Yeah, histamine itself.
Okay, so let's break down this whole histamine thing. What is it exactly?
Well, histamine is this tiny molecule, and it's actually made from an amino acid called histidine. And it's found pretty much all over your body.
Really?
Yeah, but it especially likes to hang out in your skin, your lungs, and your GI tract.
Okay, that makes sense. But what makes it, like, go haywire and cause those allergy symptoms?
Well, this is where it gets really interesting. So most histamine isn't just floating around freely. It's actually stored inside certain cells.
Oh, really?
Yeah, think of them like little histamine warehouses.
Histamine warehouses, I like
So
that.
you've got these cells called mast cells in your tissues,
Okay,
basophils and eosinophils in your blood,
gotcha.
and then these things called enterochromaffin-like cells in your stomach.
Wow. Yeah.
And they're all just kind of waiting for the signal to release their histamine payload.
So what triggers those histamine warehouses to, like, open up?
The video talks about three main triggers:
Okay.
allergic reactions, tissue injury, and then certain drugs or chemicals.
Okay, let's start with allergies.
Okay, so imagine you're exposed to pollen, like for the very first time.
Okay.
Your body is like, woo, what is this? And it goes into defense mode.
Yeah.
And it starts producing these things called IgE antibodies.
Okay.
So think of them like little wanted posters specifically for that pollen.
Okay, I'm picturing it.
Okay, so these IgE antibodies, they attach themselves to the mast cells.
Oh, right.
So basically setting a trap.
Okay.
The next time that same pollen shows up, it binds to those IgE antibodies on the mast cells.
Gotcha.
And that triggers the mast cells to release a flood of histamine.
Oh.
Bam, you've got an allergic reaction.
So that's why those allergy symptoms hit you so suddenly.
Exactly.
Like a histamine bomb going off.
It's like boom.
Okay, so tissue injury, what's that about?
It's a bit more straightforward. So anytime your cells get damaged, they release histamine as part of the inflammatory response.
Oh, okay.
So it helps to bring all the immune cells to the area to start the healing process.
So it's like sending out an SOS signal.
Exact.
Okay.
And then lastly, certain substances can directly trigger histamine release. So things like venom, some antibiotics, dyes, and even morphine. Yeah, so you got to be careful with those.
Okay, so histamine is clearly involved in a lot of different things in our bodies.
Definitely.
But how does it actually work, like, at the cellular level?
Well, histamine exerts its effects by binding to these things called receptors on cells throughout your body.
Okay, receptors.
Yeah, think of receptors like doorways on cells.
Okay.
And histamine is the key that unlocks specific doors,
Oh, interesting.
triggering a reaction inside the cell.
Okay.
There are actually four main types of these receptors:
Oh, wow.
H1, H2, H3, and H4. But for today, let's just focus on the first two,
Okay.
H1 and H2,
All right.
because those are the main targets of those antihistamines you're looking into.
All right, so let's start with H1 receptors. What happens when histamine unlocks those doors?
So H1 receptors are mostly found on blood vessels, smooth muscle, and in the brain.
Okay.
And when histamine binds to those H1 receptors on blood vessels, it makes those blood vessels dilate.
Oh.
So they get bigger and they become more permeable.
More permeable.
So it's like histamine is saying, open the floodgates, let the immune cells in.
Oh.
And that's why you get redness and swelling at the site of an allergic reaction.
So that explains the whole inflammation thing.
Yeah.
What about some of the other effects of histamine?
Well, histamine also affects the smooth muscle,
Okay.
especially in the airways of your lungs.
Okay.
So when histamine binds to H1 receptors there, it causes the airways to constrict.
Ooh.
That's why people with allergies can have a hard time breathing.
So it's not just sniffles and sneezes. It can be pretty serious.
It can be, yeah.
Okay.
And then there's histamine's effect on the brain.
Okay, the brain.
So histamine actually acts as a neurotransmitter.
Oh, wow.
And when it binds to H1 receptors there, it promotes wakefulness and suppresses your appetite.
Oh, so that explains why some allergy medications make you drowsy.
Exactly.
It's the histamine being blocked in the brain.
That's right.
Oh, that makes a lot of sense.
And then lastly, there's that annoying itch. So when histamine binds to H1 receptors on your nerve endings, it causes that sensation of itching.
Oh,
You know that mosquito bite we were talking about? That's histamine at work.
Okay, so those H1 receptors are responsible for a lot of those unpleasant allergy symptoms.
A lot of them.
What about the H2 receptors? What do they do?
So H2 receptors are mostly found in the lining of your stomach.
Hold on, H2 receptors in the stomach.
Yeah.
I thought we were talking about allergies.
I know.
How does stomach acid fit into all of this?
It's really interesting. It just goes to show how versatile histamine is in the body.
Okay.
So when histamine binds to H2 receptors, it tells those cells in your stomach lining to ramp up the production of stomach acid.
Oh, okay.
Now, some stomach acid is important for digestion,
Right.
but too much can lead to problems like ulcers.
Oh, that's no good.
No.
Okay, so we've got H1 receptors causing all sorts of allergy chaos and H2 receptors controlling stomach acid.
That's right.
So this is where antihistamines come into play.
That's exactly right.
Okay, so how do they work?
Well, it's quite clever how they work. Antihistamines don't actually get rid of histamine in your body,
Okay.
but they block it from binding to its receptors.
So they're basically putting up a do not enter sign on those histamine receptors.
Yes, that's a great way to put it. They act as what we call inverse agonists.
Inverse agonists.
Yeah, so instead of activating the receptor, they stabilize it in its inactive form.
Okay.
It's like putting a do not disturb sign on the receptor and telling histamine to go away.
I like that analogy. So
Yeah.
that's pretty amazing. But I know there are different types of antihistamines.
Yes.
First generation and second generation.
Yeah.
So what's the difference?
So the main difference is in their chemical structure
Yeah.
and how they interact with your brain.
Okay.
So first generation antihistamines like diphenhydramine,
Benadryl.
yeah, Benadryl.
Yep.
They are smaller molecules and they can easily cross what's called the blood-brain barrier.
And the blood-brain barrier is what separates the bloodstream from the brain, right?
That's right. And because those first generation antihistamines can get into the brain, they can block H1 receptors there,
Okay.
which leads to sedation.
So that's why they make you drowsy.
Exactly.
Okay.
But there's a catch. They're not very selective.
What do you mean by not very selective?
So they can bind to other receptors besides H1,
Oh, okay.
which can lead to a bunch of side effects.
Side effects.
So for instance, they can block these things called cholinergic receptors,
Okay.
which can cause dry mouth, blurred vision, and even problems urinating.
Okay, that doesn't sound fun.
Not at all. They can also block alpha adrenergic receptors,
Okay.
which can lead to low blood pressure and a rapid heartbeat.
Wow.
And to make matters worse, they can block serotonin receptors, which can make you feel extra hungry.
Oh, so have you ever felt groggy, thirsty, and weirdly hungry after taking Benadryl?
Yes.
Maybe that's why. So it sounds like there's a real trade-off with those first-generation antihistamines.
There is.
You get relief from your allergies.
Right.
But you might get some not-so-fun side effects.
Exactly. But blocking those other receptors can also be beneficial in some cases.
Oh, really?
Yeah, so it's actually why first-generation antihistamines can also help with nausea and motion sickness.
Oh, like Dramamine.
Exactly.
I never realized that was actually an antihistamine.
It is.
Wow.
And another example is promethazine,
Okay.
the active ingredient in Phenergan.
Okay.
So you see these older antihistamines, they're quite versatile,
Yeah.
even if they do come with some drawbacks.
All right, so the first-generation antihistamines are the classics,
Mm.
but they can make you sleepy and have those other quirks.
Yeah.
What about the second generation? Are they any better?
Yes, so second-generation antihistamines are designed to be more selective and less likely to make you drowsy.
Okay, good.
So they have a bulkier structure,
Oh,
making it harder for them to cross the blood-brain barrier and get into the brain.
so they're more focused on blocking those peripheral H1 receptors,
Yes.
the ones involved in allergies rather than the ones in the brain.
Exactly.
Okay.
So they provide similar allergy relief, but with fewer of those annoying side effects like drowsiness.
So that sounds better.
Yeah.
What are some examples of second generation?
Some common examples are cetirizine,
Zyrtec,
Zyrtec, loratadine,
Claritin,
Claritin, and fexofenadine.
Allegra.
Allegra.
Yeah, okay. Those are all familiar names. The second generation sounds like the way to go if you don't want to feel sleepy.
Yeah, if you want to avoid that.
Are there any other interesting innovations in the world of antihistamines?
There are.
Oh, really?
Yeah, so some second-generation antihistamines like azelastine, olopatadine, and ketotifen,
Okay.
they have an extra trick up their sleeve.
Okay. I'm intrigued. Tell me more.
So they not only block H1 receptors,
Okay.
but they also stabilize mast cells, preventing them from releasing histamine in the first place.
Whoa, so they're attacking the problem from two different angles.
Yes, they are.
That's really incredible.
It,
But there's one thing I'm still wondering about. We've been talking a lot about H1 blockers for allergies.
right.
But what about those H2 receptors involved in stomach acid?
Yeah.
Are there medications that target those too?
You bet there are. They're called H2 antagonists or H2 blockers.
Okay.
And they specifically target histamine's role in stomach acid production.
So how do they work? Do they, like, completely shut down acid production?
Not exactly. So producing stomach acid is a bit more complex than just histamine giving the order.
Okay.
It actually involves this like teamwork between acetylcholine, gastrin, and histamine.
Okay, walk me through this teamwork. How does it work?
Okay, so imagine your stomach lining is like a construction site.
All right, I like it.
Okay, so acetylcholine from the vagus nerve acts like the initial signal. It's like, all right, team, start building acid.
All right, let's go.
And then gastrin, a hormone that's produced in your stomach, arrives to kind of further encourage the construction effort.
Okay.
And then finally, histamine comes along to really get things going. So it boosts the activity of this enzyme called the proton pump,
Okay.
which is responsible for actually pumping hydrogen ions, which is the acid, into your stomach.
So it's a multi-step process,
It is.
with histamine playing a key role in actually making the acid.
That's right.
Okay.
So H2 blockers step in, and they specifically target histamine's part in this process.
Okay.
So they don't completely shut down acid production, but they significantly reduce it,
Okay.
which can be really helpful for things like ulcers and GERD.
That makes a lot of sense.
Right.
So what are some of those common H2 blockers? Are there any names I might recognize?
Yeah, you might know cimetidine,
Tagamet?
tagamet famotidine,
Pepsid.
pepsinizotidine,
Axid.
Axid and ranitidine,
Zantac.
Zantac.
Yeah, okay, I've heard of those. So are they all pretty safe to take?
They're generally well tolerated, but cimetidine can have some unique side effects.
Oh, good to know. Okay, so we've covered a lot of ground already.
We have.
We started with the basics of histamine, where it's found what triggers it and how it works by binding to those different receptors.
Right.
Then we dove into the different types of antihistamines.
Well, you did.
Talked about how they work, those different generations of H1 blockers,
Uh-huh.
and even H2 antagonists for stomach acid.
Yeah, we did a lot.
I know. It's a lot to take in, but that's what deep dives are all about.
Exactly.
So are you ready to move on to part 2 of this antihistamine adventure?
Let's dive in. There's still so much more to uncover.
Awesome. Let's do it.
Uh-huh.
Okay, so we've tackled the basics of histamine and, those classic antihistamines, but the research you sent goes like even deeper.
It did.
There's this whole world of like different approaches to dealing with histamine.
It's true.
It's like a histamine strategy game.
It really is, and some of these strategies go beyond just like blocking histamine or preventing its release.
All right, spill the beans. What are we talking about here?
Okay, well, there's this medication called cromolyn sodium, and it's often categorized as a mast cell stabilizer,
Oh.
like ketuphenazolastine and olopatadine.
Yeah, those are the ones that like prevent histamine release in the first place.
That's right.
Pretty cool strategy.
Yes. But cromolyn is interesting because it works a bit differently. So instead of like messing with histamine directly, it seems to block calcium channels in mast cells.
Okay, hold on. Calcium channels. Why are those important in like this whole histamine drama?
So remember how histamine is stored in those little granules inside mast cells?
Yeah, like those little histamine warehouses.
Exactly. So when an allergen triggers a mast cell, calcium ions rush into the cell.
Okay.
And that flood of calcium is what ultimately causes those granules to release their histamine payload.
So cromolyn, by blocking those calcium channels, is basically like cutting off the signal that tells the mast cells to release histamine.
Precisely. It's like putting a lock on the exit door of those histamine warehouses,
I like that analogy.
preventing the histamine from escaping even if the alarm is blaring.
Okay, so cromolyn is like a preemptive strike against histamine release.
Exactly.
It's stopping the problem before it even starts.
That's right.
I like it. So when do you actually use cromolyn?
It's often used prophylactically,
Prophylactically.
meaning you take it before you're even exposed to an allergen.
Oh, okay.
So like before heading out during pollen season.
So it's not really for those like sudden allergy symptoms like sneezing or itching.
Right. It's more for preventing those symptoms from happening in the first place.
Okay, so it's like a preventative measure.
Exactly. And it's often used for things like allergic rhinitis, asthma, and even food allergies.
Wow, that is versatile.
Yeah.
So we've got antihistamines that block histamine from binding.
Right.
We've got mast cell stabilizers like cromolyn that prevent histamine release.
Yep.
Are there any other tricks up our sleeve for dealing with these histamine issues?
There are a few other interesting approaches.
Okay.
So one that's gaining traction is the use of natural antihistamines.
Wait, natural antihistamines, what are those?
So these are compounds found in certain foods and plants that have antihistamine properties.
Oh, yeah.
So for example, quercetin is a flavonoid found in fruits, vegetables, and tea.
Okay.
And studies show it has both antihistamine and mast cell stabilizing effects.
So you're telling me I could get allergy relief just from eating certain foods?
That's the idea. The research is still ongoing, and we need more studies to confirm the effectiveness and the best dosages, but it's a fascinating area to explore for sure.
Yeah, I'm always down for adding more fruits and veggies to my diet, especially if they can help with allergies. Are there any other natural antihistamines worth noting?
Another one that comes up a lot is bromelain.
Bromelain.
It's an enzyme found in pineapple,
Pineapple, okay.
and it's believed to break down histamine in the body.
So instead of blocking histamine or preventing its release, it's actually helping to eliminate it from the body.
Exactly. Again, more research is needed, but it's a promising area for future investigation.
This is blowing my mind. I had no idea there were so many different ways to target histamine and its effects. It's like this whole new world of allergy management has opened up.
It really has, and it's a great reminder that there's always more to learn, even about things we think we know well.
Speaking of learning more, the video we've been discussing mainly focused on H1 and H2 receptors.
Great.
But you mentioned earlier that there are actually 4 types of histamine receptors, right?
That's right.
What about those other two, H3 and H4?
Yeah,
What do they do?
but that's a great question. We've really only scratched the surface of histamine's complexity.
Man.
H3 and H4 receptors are less well understood than their H1 and H2 counterparts,
Okay.
but they're starting to gain some attention as potential therapeutic targets.
Okay, I'm really curious now. What do we know about them so far?
Well, H3 receptors are primarily found in the central nervous system,
Okay.
and they're involved in regulating the release of various neurotransmitters, including histamine itself.
So they're like histamine's own internal control system.
You could say that they help to fine-tune histamine signaling in the brain,
Okay.
and they're involved in a bunch of functions, including your sleep-wake cycles, cognition, and even pain perception.
Wow, so targeting H3 receptors could be helpful for things like insomnia or chronic pain.
It's definitely a possibility. There's a lot of research focused on developing drugs that specifically target H3 receptors, but it's still early days. There are still challenges to overcome, like figuring out how to target these receptors specifically without causing unwanted side effects.
It sounds like there's a lot of potential there, but also a lot of work to be done. What about H4 receptors? What's the scoop on those?
So H4 receptors are primarily found on immune cells,
Okay.
like mast cells, eosinophils, and T cells.
Ah, so we're back to the realm of allergies and inflammation.
They seem to play a role in controlling immune responses, although their exact functions are still being unraveled.
So H4 blockers could be like a new frontier in allergy treatment.
It's definitely possible. But as with H3, it's early days. We need more research to fully understand H4 receptors and their role in allergies and other inflammatory conditions. And of course, we need to develop drugs that can target them safely and effectively.
This is all incredibly fascinating. It seems like we're just beginning to unlock the secrets of histamine and its receptors.
We are.
There's so much potential for developing new and better treatments for all sorts of conditions.
It's truly an exciting time, and it really highlights how even the most common medications can have these hidden depths. And our understanding of the human body is constantly evolving.
Okay, I'm feeling a little overwhelmed in a good way.
I know, me too.
We've covered so much in this deep dive.
We have.
Maybe we should take a step back and recap what we've learned so far before moving on.
That's a good idea. It's easy to get lost in all the details.
I know. So we started by exploring histamine, where it's found, what triggers it, and how it works by binding to those different receptors. Then we dove into the different types of antihistamines, talking about how they work, those different generations of H1 blockers and even H2 antagonists for stomach acid.
Yep.
And we even touched on some alternative approaches to dealing with histamine, like mast cell stabilizers and natural antihistamines.
Yes.
And we just started to peek into the world of those lesser-known H3 and H4 receptors, highlighting the research and potential therapeutic applications.
It's been quite a journey.
It really has, and I feel like we've only just begun to scratch the surface.
We have. That's the beauty of science, right? There's always more to discover.
Are you ready to dive into part 3 of this antihistamine adventure?
I'm ready when you are. There's still so much to explore.
Okay, so we've explored this amazing world of histamine, right from its role in those annoying allergies to its surprising connection to stomach acid.
Yeah.
And we even uncovered some secret weapons for managing histamine, like those mast cell stabilizers and natural antihistamines. But before we wrap up our deep dive into the world of antihistamines, there's one more thing we need to talk about.
Yeah, what's that?
Being smart about using these medications.
Oh, that's a really good point. We've been focusing on, the specific ways that antihistamines work.
Right.
But it's important to remember that, our bodies are incredibly complex systems.
Yeah. Yeah.
And these medications can sometimes have effects that go beyond just their intended targets.
Right. Okay, so what are some things that we need to keep in mind?
Well, one important thing to consider is the potential for drug interactions.
Oh, yeah.
So antihistamines can interact with other medications you might be taking.
Yeah.
Leading to, unexpected side effects or making the medications less effective.
Makes sense. Are there any specific interactions that are particularly worrisome?
Well, those first-generation antihistamines,
Yeah, the ones with the broader effects?
yeah, those ones, they're more likely to interact with other drugs.
Okay.
For example, they can amplify the sedative effects of alcohol or other medications that slow down your central nervous system.
Gotcha. So you definitely want to be careful about mixing those.
Yes, definitely.
What about those second-generation antihistamines? Are they generally safer when it comes to interactions?
They tend to have fewer interactions because they're, more selective in how they work.
Yeah.
But it's always a good idea to chat with your doctor or pharmacist
Yeah.
about any other medications you're taking, just to be on the safe side.
That's always good advice.
Mm.
What other potential concerns should we be aware of?
Another thing to remember is that antihistamines can sometimes mask underlying conditions.
Oh.
So if you're constantly relying on antihistamines to manage, your allergy symptoms,
Right.
it might be a sign that you have, a more serious allergy that needs attention.
So popping antihistamines all the time might not be the best solution long term.
Right. It's better to, get to the root of the problem.
Yeah, get to the root of the problem.
It's always best to get a proper diagnosis from your doctor. And make sure you're treating the cause of the problem, not just covering up the symptoms.
Gotcha. Are there any situations where using antihistamines might not be the best approach at all?
Yes, believe it or not, sometimes histamine actually plays a helpful role.
What?
Yeah, for example, it's involved in wound healing
Oh.
and immune responses.
Oh.
So blocking histamine completely might not always be the best idea.
So histamine isn't always the villain.
Right, it's more complicated than that.
It's all about balance
Exactly.
and understanding, the context of what's going on in your body.
That's right.
Wow. This has been so insightful.
Yeah, it has.
It's a good reminder that medications are powerful tools,
They are.
but we need to use them wisely
Yes.
and understand their potential effects. We don't want to turn into those people who just pop pills without even thinking about what they're doing.
You're absolutely right. It's about, empowering yourself with knowledge so you can make informed decisions about your health.
Well said. I think we've covered a ton of information in this deep dive.
We have.
We explored the fascinating world of histamine and its many roles in the body.
Yes.
We went deep into how different types of antihistamines work.
Uh-huh.
And we even touched on some of the, broader considerations of using these medications.
We did.
It's mind-blowing to think that there's so much to learn about something as seemingly simple as an antihistamine.
It really is incredible. And, I hope our listeners have found this as enlightening as we have.
I'm sure they have. So as we wrap up this deep dive, what's the one key takeaway you want our listener to remember about antihistamines?
I think the most important thing is to approach medications with a sense of curiosity and critical thinking.
Okay.
Don't just take them blindly.
Right.
Ask questions, do your research,
Yeah.
and try to understand how they work.
Gotcha.
And of course, always talk to your doctor or pharmacist if you have any concerns.
Yeah, that's great advice, and I think that applies to all aspects of our health,
Absolutely.
not just medications,
That's right.
We should be informed and proactive about our well-being.
I agree. Knowledge is power.
Yeah.
The more we understand about our bodies and how things work, the better equipped we are to make good decisions about our health.
That's a perfect note to end on, but before we say goodbye, I want to leave our listeners with a final thought to ponder.
Okay.
So we've learned how, tweaking histamine levels can have a huge impact on different parts of our health,
Yeah.
from, allergies to stomach acid and even sleep and how our brains work.
Uh-huh.
So it makes me wonder what other possibilities are out there.
That's a great question.
Could there be, other undiscovered benefits to targeting specific histamine receptors?
Hmm.
Or maybe even using histamine itself for therapeutic purposes?
Yeah.
It seems like there's still so much more to explore in the world of histamine research.
It's a fascinating thought, and it just shows that our understanding of histamine and its potential is constantly evolving. There's always something new to discover.
Well, on that note, we'll say goodbye for now.
But keep diving deep into the world of knowledge and never stop asking questions.